What's up, guys? Welcome back to Kimmy D TV, tips and tricks living your best life. In this video, I'm going to be teaching you guys how to admit a patient into a long-term care facility step by step. Okay, guys, so I used to work in a SNF facility, so some people may call it long-term care facility, some people may not. SNF means skilled nursing facility. So basically I had to admit patients, and before, like I said, when I was working in New York, I never had to admit patients. I was just giving meds. But here in Texas, they make the nurses do something a little bit different. At this moment, I do not work at a SNF now. I work in a prison. Not a prison. I work at a jail, and if you guys want to know more about the jail, just leave it in the comments down below, and I'll be sure to make a video about that. But I remember somebody asked me to make this video like a couple of weeks back, so I'm going to make this video first. But yeah, so without further ado, this is how to admit a patient into facility step by step. Okay, guys, so as you guys may know, with all my other step-by-step videos, of course, it's going to vary from place to place. It may not be exact, but this is just kind of going to give you a basic or a blueprint, if you will, on how to admit a patient to a long-term care facility. So if you see me looking down, I'm looking at my checklist paper that my old facility gave me. So when a resident first comes to the facility, hopefully if the facility is good, sometimes they don't, they will call you in advance. So they will call you in advance and they will tell you, hey, this person is being admitted to facility. They usually have an admission packet, like admissions will give you an admission packet, and then you will take report from the nurse where they're coming from. Like, so for example, let's say patient Jamie is coming in today at 1:30 p.m., right? So you will have a paper, and it's called your nurse's report paper. And let's say they're coming at 1:30, let's say at 12:30, the nurse will call you at the office, not at the office, but the nurse will call you at your nurse's station. And like, for example, they would tell me, oh, hall 400 nurse, you have a call. So I would go to the phone and pick it up, and it will be the nurse from the hospital, or it would be a nurse from their house, because sometimes, so where I work, we used to do something called respite care. So respite care is where a patient would come for like maybe 2 or 3 days. So let's say a patient is being taken care of by their family member and they need a break. They would come to our facility for 2 or 3 days, and then they would just go back. So or sometimes they're hospice or wherever they came from. So, but usually it's a hospital. So a nurse will give you a report from the hospital. So you have like a little sheet to fill out, and you would like fill out all the information. Sometimes I like to just have a blank sheet of paper and ask all my questions and then fill out the paper, because sometimes the paper that you fill out is confusing. So basically, during the nurse's report, you're gonna every facility is going to be different, but usually you're going to want to know if the patient is on oxygen, how many liters of oxygen they're on, of course their name, date of birth, all those things like that. What insurance are they covered under? Is it Medicare, Medicaid, what, like Part A, Part B. You're going to want to know the name of the physician. You're going to want to know their admitting diagnosis. You're going to want to know their history diagnosis, so all the diagnoses that they had in their history. You're going to want to know when was the last time they had a bowel movement. You're going to want to know if they have a Foley catheter. You're going to want to know how long ago it was changed, like it was changed 3 days ago, 2 days ago. You're going to want to know what medications the patient's in, but usually the medications come in the admission packet that the patient will come in with. But you're gonna want to know, like, overall, like, what kind of patient is coming in. Are they via stretcher? Are they paralyzed? You're gonna want to know all that information. And one thing that's very important is you're gonna want to know if they're on any narcotics. Ask them if they're gonna send the triplicate, because on certain narcotics you don't need a triplicate, but for certain narcotics like tramadol or hydrocodone, you're gonna need a triplicate. And sometimes, like, if the patient is being admitted later, during the day, your doctor that's in your facility may have gone home already, but if you have that triplicate, you could fax it to the pharmacy, which we will get to that point later. But just know, when you're getting a report from the patient, from the nurse, ask them, hey, does the patient have a narcotic that needs a triplicate, so that they could send it over. Ask them, can you send that over? Because that is very annoying, because when a patient comes, if they're in pain and they need their medication, that is very annoying, because with certain medications, pharmacy won't give it to you until they have a triplicate. Another thing is peak line. If they have an IV, that's very important to know. Especially if their IV days are over. Say, did you remove the peak line? That's very important. If they have to remove it. If they don't, of course, you have to, you know, and then you ask the patient, and you also ask, oh, are they two-person assist with transferring from the bed to the wheelchair? You know, is the patient a fall risk? You know, all those questions you want to ask. What kind of diet are they on? Is it regular? Is it thin? Like, you know, all these questions you ask. And you know, when the patient comes in, yeah, sometimes they have that information in the packet, but sometimes they don't. So that's basically why I like to ask all these questions. Okay, so you got your report, you know, so you're on the floor, you're doing your other work, and then your patient finally comes. Yay! Before the patient comes, though, some facilities, they do it for you, but some facilities, they don't. I like to tell my housekeeping, hey, this patient is going in room 4088, and usually the admissions will tell you which room they will be in. If they don't, you just have to pick a room. Because some rooms are assigned based off of what kind of insurance they have. Like certain, like, I'm not really too sure, but sometimes if a patient is on Medicare, they're on one single room, but if they're on Medicaid, it's a double room. So that's why you should know, not just assign. But if they say, okay, just go ahead and assign, just assign. So whatever patient's room they are, I like to check the room and tell this housekeeping is like, oh, hello, can you please, you know, we have a new admission, can you please clean up this room real quick, we have a patient coming. And then you also want to give them their welcome packet. So the welcome packet will be like soap, shampoo, blah blah blah, you know, soap, shampoo, toothpaste, toothbrush, like little stuff like that, stuff that you would give in a hotel, really. But no, seriously, you would prepare that for them. That's not really dire important, but that is one of the things that we do give. Like I said, and every facility is different. Some people may give it for them. But yeah, you're just going to want to let them know, and you're going to let the supervisor know, hey, we have a new admission coming. Once the new admission comes via stretcher, via wheelchair, whatever, you're going to want to mark down the time they come. Like, let's say they come at 12:15. We're gonna want to mentally mark down what time they come, and I'll get to you why later, because that's gonna help you with your admission note. So the patient comes, and you know, you're gonna want to take their vital signs first thing before the EMS leaves. You're gonna want to take their vital signs, make sure that they're stable, make sure that they don't give you a patient that's half dead. Make sure that they're stable. Take their vital signs. You know, find out if they're fall risk. Yeah, the first thing you want to do is, and then they're gonna give you the EMS is going to give you a bunch of papers to sign. So you're going to sign those papers, and you're going to take their vital signs. And after you take their vital signs, they'll be okay. And then you'll check to see if they have any wounds. Oh, I forgot that. When you're getting report from the nurse from the hospital, make sure you check to see, ask them, oh, do you have any wounds? The next thing you're going to do is you're going to do a quick skin check. If the patient is not that heavy, you can do it yourself. Or if not, ask somebody to help you. And you're going to do a quick skin check, you know. Just check the areas, especially where, you know, like the bony prominences, where places there are prone to get like a DTI. So you're going to check their sacral, of course. You're going to check any places where it's bone and skin. Like, you're going to check their feet, of course, because that's, I don't know why, that always breaks down. And you're going to note down any skin tears or anything that they have. Yeah, but so you're going to just note that down. And then, like, just make a mental note. Make a mental note of how it looks like is stage 2, stage 3, or whatever. Well, actually, you're not really allowed to stage, but I'll get to it. But basically, just make a mental note of any scabs or any wounds that they have, and maybe write it down on a piece of paper if that helps you. Yeah, you probably should write it down on a piece of paper, especially if you're new to admitting patients. So that's what you do, and then, you know, you get them in the bed, you put in the lowest position, say, hey, welcome, blah, blah, blah. And we'll be right with you. you know. And then after they leave and stuff like that, you're gonna want to write your admissions note. Now, I'm saying this in order, but it may not go in that order because you may be pulled in several different directions. Maybe another patient asking for pain medicine, but ideally you want to write your admissions note, and your admission note should be quite lengthy. You're gonna want to say patient Jamie came at 12:15 a.m. Via stretcher. Patient's vital signs was this, this, and that. Patient's head cephalic. Patient is straight. Pupils equal and reactive to light. You're going to want to say just basically an overall summary of the patients, and you're going to use some of what you got from the nurse in the hospital to help you. Like, patient has wound to sacral, patient is 2-person assist, you know, patient is, and then at the end you're going to want to put patient resting comfortably in bed. You know what I'm saying? You're going to just want to say a patient, you know, adjusting well to the unit, will continue to monitor. You know, you want to give that admissions note. So that's basically what your admission note is. It should be like a good paragraph, you know, maybe 6-7 sentences, just saying, like, basically, you know, what the patient is, like, totally and fully. If you guys want to make a separate video on, like, an admission note, like, let me know. I will make a separate video on that if you guys want to see, like, how I do my admission note. I'm not saying mine is the best, but I never had any complaints. So, you know, you just want to say, like, fully how you received the patient, any skin breakdown, how the patient assisted. You even want to put, like, oh, the patient is on clear liquid diet, blah, blah, blah. And then, you know, all of that. So, after that, you finish the admission note. The admission packet should have already came with the EMS maybe. So the first thing you want to do, the first things first, is the medication. So in your admission packet, you're going to get a list of medications, and with that list of medications, you're going to call the doctor and verify all the orders. And now why I say, like, the medications is the first thing you should do, even sometimes before the admissions note. I mean, whatever you can do first, but medications is so important, is because let's say 2 hours from now the patient is requesting pain medication, and they're not going to understand, well, we have to call the pharmacy, but they're not really going to understand that. They're going to think it's speaking Chinese, like, I don't care, I want my medication now. That's the language they understand. So you're going to want to call your doctor, and from the medication packet, there's going to be a medication list that says final medication order or final list order, and you're going to call the doctor or the nurse practitioner, whoever is assigned to that patient, and you're going to be like, hey, doctor whatever, I have a patient here. Just give a brief little summary. Usually the doctor doesn't want like a whole essay. They don't. They're busy. Say, hey, I have patient Jamie here, came at 12:15 p.m. Patient is 2-person assist. Patient, like, usually just tell them their diagnosis. That's the most important thing. I have some medications to review with you. Are you ready for them? And they're like, yeah. And then you just say all the medications. Patients on Zofran 6 milligrams BID for blah blah blah. Patients on blah blah blah. And they'll be like, okay. And then, like, you just literally write down and check off all the medications that the doctor says. Okay. So the patient the doctor will most likely continue all the medications until the next day when they come evaluate the patients, and then if they want to tweak anything, they will tweak it. So once the doctor has approved all the medications, yes. And, you know, the tricky part about that is that sometimes the doctor can't be reached. You gotta call a nurse practitioner. Sometimes they're busy. They say, oh, I'll call you back. All that wastes time. That's what gets me annoyed. Because at the end of the day, okay, I understand you're busy or blah, 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 but the patient family member is going to come yell at me because they want their pain medication or they want their baclofen, you know, because they're spasming. But anywho, that's what you do. That's why I'm saying, like, just try to get the medications done, like, ASAP. Like, hopefully the doctor will answer. Like, I'll be hunting down the doctor. I'll be like, and the doctor's like, oh, I'm busy. I'm like, it will only take a little bit. Like, I really tried to get the doctors or nurse practitioners to approve it, because I'm not about that life of people yelling at me. But anyways, so the doctor approves everything. The next thing you're going to do is you're going to want to put all the medications on the computer. So basically, it's so simple. based off of whatever program you use, or somebody will teach you. But you just put the medications in the computer. Sometimes that could be tedious too, because sometimes you got to find the medication. Sometimes you got to put it exactly, like if it's extended release, or if it's a certain liquid, or you got to put exact. So that's why it could be kind of difficult. And that's under your license, under your name, so you got to make sure you get that right. That's not something you want to mess up on, is when you're putting medications, because everybody's gonna administer medications according to how you put it in. So basically, I'll put medications, and next thing is consent. Some people, you need a consent to treat. When I did travel nursing in El Paso, like, everybody had to sign a consent to treat. With psych patients, if the patient is on psych medications, and in my old facility, they even considered something like Benadryl a psych medicine, because they said it's a hypnotic, because it makes you go to sleep. For each medication, for each psych medication, they need a separate psych sheet that the patient has to sign for consent, or whoever is allowed to sign consent. If the patient cannot write and they have no family member, 2 nurses have to sign, and they have to both agree. They have to ask the patient, oh, can they sign? And that's how they will sign. But let's say the patient is on Ativan, so Ativan 0.5, you have a separate sheet for Ativan 0.5, have the patient sign that. Have a separate sheet for Trazodone 2.2 milligrams, have the patient sign that. But basically, the patient has to sign each sheet for their psych medications. Like, that is very important, guys, because let's say 2 weeks later, the patient's like, I never asked, what's that blue pill? And then the patient's like, oh, well, it's Ativan. Like, you were giving me Ativan? Like, I'm not crazy. Why were you giving that to me? And then because they're like, okay, who admitted the patient? And because you forgot, or you didn't relay to the other patient, like, but I'm sorry. You're going to be like, oh, listen, we need that consent, and you didn't get that consent. It's like, you could get in serious trouble, because people could sue, be like, oh, you were giving me psych medication. So those psych consents are so important. So that is all for the medications. So the next thing you're going to do, you want to do an inventory. So usually where I was working in El Paso, I would give the CNAs an inventory sheet, and they would fill out the inventory. But in my old place, I had to fill it out. So basically, inventory is like counting how many shirts they have, counting how many pants they have, if they have a cell phone, if they have a radio, whatever. You want to put that in, because that's basically covering the facilities. But if you lose anything, well, it wasn't documented in inventory. That's basically the point of that, especially if they have any jewelry or anything. Oh yes, and I forgot, during the admissions note, when you're taking report from the previous nurse, you're going to want to ask, are there any follow-up appointments for the doctor, for any doctors? So if they say yes, they'll let you know, but usually it's in the admissions packet too. So if there's any follow-up appointments, it's up to the day shift nurse to call. Like, so let's say they say, well, Dr. Zagaga wants them to follow up with them for a full physical in 2 weeks. You're going to want to call Dr. Sagaga's office and say, hey, I'm calling from blah, blah, blah. I want to make an appointment for this patient 2 weeks from now, and then you make the appointments. It's usually the day shift nurse that is responsible for making the appointments. Because nighttime, like, nobody's here at night. So it's usually the day shift that's responsible for making the appointments. And when you make the appointments, you're going to want to get your admissions appointment packet ready. It's a lot of work, right? You got to do your, got to print face sheet, list of medications, list of labs, and that's basically it. And then you put it in an envelope, and they leave when they go. You don't have to make the admissions packet right when you make the admissions, but you're going to want to make a note of, okay, what admissions to do. And keep in mind, all these steps I'm telling you, they don't have to be done on the first day. But the important stuff that has to be done on the first day is the admissions note, the medications, of course, and then also you want to know their dietary. So you want to put that order in. That is an order. So you want to put their dietary order in, and usually I would print it out and give it to dietary in El Paso, and here I would just print it out and give it to them there too. So when you have the diet, print it out and give it to dietary. That's another thing that's important, because if the dietary doesn't have the patient's order, and let's say lunch comes in, oh, you will have a field day with the family. They'll be like, where's my patient's diet, blah blah blah. And then because you didn't give them that dietary order, they don't have no food, the family will have a fit, and then that will slow dietary up. So make sure you have that dietary order in. Let's see. So after that, in my facility that I used to work in, I would have to do something called admissions orders. So basically, admissions orders would be something it's just like a template based off of my specific software that I used. So with my admissions orders, I would put it would be something simple like, oh, do you verify that the patient is able to receive care in the state of Texas? Yes. And it will be something like maybe weights daily or maybe weights every other week, some like vital signs for 7 days or whatever. It will be something so simple, or how many assistant, like 2-person assist, just so that it will pop up in the CNA's thing, so that they will see, oh, okay, they're 2-person assist. Basically, admissions order is just some general stuff that they get. Behavior monitoring, that's something we did in my facility too, not in El Paso, but the facility I just was working at. We would do behavior monitoring. So that will be another order. Behavior monitoring is basically during your shift, you would say, especially if they're on a psych med, you do behavior monitoring. That's the only time you would do behavior monitoring. So let's say they're on trazodone, they'll be like, okay, how was the patient's behavior on a scale of 1 to 6? So I would schedule that order for nurses to document that on every shift. So because our shift was 6 to 6, so I'll be like 6 a.m. to 6 p.m. and then 6 p.m. to 6 a.m. Every nurse, you're supposed to document how was their behavior that shift. So it'll be like 1 to 6, stuff like that. And that would be it. If I see that they have a wound, I would put in an order under the flow sheet of the wound care nurse. Say patient has wound on sacral, wound care nurse to evaluate and treat, so that it will pop up on her shift, on her flow sheet the next day, so that they will, so that the wound care nurse can evaluate and treat the patient. Also TB testing, all our patients, we always do our TB testing and the flu vaccines. So I will also schedule that in. Usually it's supposed to be the day they come in, if not the next day. And then you also schedule, the time that they will read the TB testing, and then you will do TB testing part 2. You go on to the nursing data collection tool. It's a lot of work, guys. After that, you're gonna fill in risk observations like fall risk, and then you're going to do observations for pain. You're going to do a Braden scale, and a Braden is basically like how much are they at risk, like mentally, like do they have Alzheimer's, do they have dementia. And then from that, if the Braden is 18 or less, and then you're going to do a skin risk analysis, saying like, okay, how often are they moist, stuff like that, to see like what kind of plan of care are we going to do for the patients. And we're also going to review the code status, which is very important. We're going to put that in if they're full code, if they're DNR, that's very important. And then after that, what we did, because we use something called Matrix, so basically we would upload all the documents online because we didn't have any charts, because as you guys know, like nursing is becoming extremely computerized. So all the documents that we got from the mission packets, we would upload it to Matrix and it would just be on the computer. And then check that the height and weight have been entered, so we would get the weight of the patient the same day. Or some people, they call the hospital that they came from, like, oh, what's their weight, what's their recent rate. And then you make sure that the blood pressure, temperature, pulse rate is put in. And then you complete their baseline care plan, which is basically a template that we used to use. That's what I'm saying, every facility is going to be different. And we would say, oh, patient is this, patient is that. We would just fill it in. And then the next day, the supervisor or the RN would come in and make a full care plan for the patient, and that's basically it. That is how to admit a patient into a facility step by step. Now, like I said, there's no way you're gonna finish all of this in one day. Some people do. Once you get quick at it, you probably will. But the main thing that's important, I would say, is make sure the dietary is put in, make sure the patient's medication is put in, make sure your admissions note is put in, because we have to know when the patient came in. You can't just leave it blank. And then make sure you get the psych consent, and make sure you know if you're gonna follow up on any patients, appointments. So, like, there's no way that one person can do everything. Usually, if you don't finish everything, you have to endorse it to the next shift. That's basically how it is. But some facilities, some nurses, for some reason, they don't want to do it, and I don't understand it. But usually you have to endorse it to the next shift, because there's no way you could do everything. But make sure you get that patient medication, and make sure you get the nurse's note in. And yeah, guys. So, guys, that is how you admit a patient to the facility. I know this was kind of quick and kind of like straight through, but if you guys have any questions, just definitely let me know, and I'll see you guys in the next one. Bye.